Hello, welcome to my presentation on healthcare access in Southeast Asia. Today I'm going to be discussing the challenges that are faced within Southeast Asia and the region, as well as some of the organizations that are working towards better access throughout the regions. So, to start, I'm going to talk about some of the biggest challenges that I found throughout my research in regards to healthcare access. Is typically the wide disparity in healthcare infrastructure and resources between the different countries, and even within themselves. So, while some countries such as Singapore have a really well developed healthcare system, other countries such as Myanmar and Laos have really severe underdeveloped healthcare systems and are actually unable to meet the needs of their population. Additionally, many people face financial barriers to access healthcare. Things like out of pocket expenses are a bit difficult for those that are in lower rural areas or even low income populations, making it, a little bit harder to access these services. Uh, Even lack of medical resources, such as healthcare providers, can be an issue when having to even pay out of pocket and living in these areas. Things like infectious diseases such as malaria and tuberculosis are pretty common and significant healthcare challenge in Southeast Asia, particularly in the less developed areas. Um, Overall, to address these challenges, it's going to require a combination of increased investment in healthcare infrastructure and resources to improve the access of healthcare services and expanded efforts to prevent these diseases. So, now I'm going to talk about some of the organizations that are working towards better healthcare access in Southeast Asia. Some of these are the World Health Organization, the Asian Development Bank, Health Volunteers Overseas, Medicine Sans Frontiers, Red Cross. And so to begin with, I'm going to start with, as you see on the slide here, are the Health Volunteers Overseas. I'm going to just explain what it is really quick. It's a nonprofit organization that sends healthcare professionals to basically areas that are still developing, so developing countries. They provide training and education for local healthcare providers to improve their skills and knowledge in these areas as well. And they're really collaborative with local partners to build these sustainable healthcare programs. Um, and as you see to the right is the Asian Development Bank. So a little bit about them. They're basically a bank that aims to alleviate poverty in the Asia and Pacific region. So by doing so, they provide funding and technical assistance for healthcare projects in those regions. So they really focus on improving healthcare systems, reducing health risks, and increasing access to essential health services. So what they've actually done for Southeast Asia, they've contributed to economic growth and development in Southeast Asia by investing in these infrastructures and supporting poverty reduction initiatives by promoting environmental sustainability and making these partnerships with the government and society organizations. So, through these investments in transport, energy, and telecommunications infrastructures, they've helped improve the connectivity and support throughout this economic. So basically, they're an advocacy for environmental sustainability, and they supported the initiatives to reduce carbon emission, protect biodiversity, and improve access to clean water and sanitation. So they do play a pretty crucial role in supporting sustainable and inclusive development within these regions. Um, so next, I'm going to talk about the World Health Organization, also known as WHO. They're a specialized agency of the United Nations that aim to promote health, keep the world safe, and serve the vulnerable, I guess. So they work with countries to improve healthcare systems, to strengthen health surveillance, and respond to emergencies. And they have a variety of programs that are specifically targeting health issues such as immunizations, tuberculosis, and malaria. So they've actually helped out Southeast Asia by addressing public health emergencies such as outbreaks of infections, diseases, providing technical assistance such as like to strengthen their healthcare systems by promoting universal health coverage and supporting research and innovation. So they've really been a strong advocate for the universal health coverage, calling on governments in the region to provide access to quality healthcare for all of their citizens, regardless of their ability to pay. So they definitely continue to play a really vital role in improving healthcare access and outcomes in Southeast Asia. The next organization that I'm going to talk about is the Medicine Sans Frontiers. They're basically an international medical humanitarian organization that provides medical assistance in emergency situations and conflict zones. So they work to provide to access. They work to provide access to essential healthcare services to vulnerable populations, including refugees, internally displaced people, and victims of natural disasters. So they're also known as Doctors Without Borders, and they provided a significant medical and assistance in Southeast Asia for decades. The organization responded to emergencies and natural disasters such as the 2004 Indian Ocean tsunami by providing emergency medical care, treating injuries, and providing psychological support to affected communities. They've also supported maternal and child health by providing medical care and support to pregnant women, newborns, and even young children, while still advocating for essential healthcare services. So they've really helped to improve healthcare access and outcomes in Southeast Asia, and are still continuing to save countless lives. So the next organization that I'm going to get into is the Red Cross. So pretty similar to the last one, they're an organization that provides emergency assistance during disaster relief and education around the world. So they provide healthcare services and support for vulnerable populations. They include the elderly, disabled, and even those living in poverty. So the organization is responding to numerous disasters in the region, including, as previously mentioned, the 2004 Indian Ocean tsunami, and the 2013 typhoon in the Philippines, and the 2018 earthquake that happened in Sulawesi, and a tsunami in Indonesia. So they were providing emergency relief, medical care, and again, psychological support to affected communities. So they've also supported disaster risk reduction and preparedness efforts, working with local communities to develop early warning systems and disaster response plans. In addition to its emergency response efforts, the Red Cross has worked to promote community health and well-being, and they are continuing to place efforts into save lives and improve the well-being of across Southeast Asia. So one thing that I noticed is that there is a pretty big comparison when you're comparing Southeast Asia as a whole to its neighboring regions, of course. It really varies wildly across the region. Um, so Singapore has the highest healthcare access compared to Thailand, which is actually what follows next. It would be Thailand, Malaysia, Indonesia, Vietnam, and then the Philippines. So some of the factors that affect healthcare access include funding, infrastructure, healthcare workforce, and health insurance coverage. So countries with higher health expenditure and more healthcare workers tend to have better healthcare access, while healthcare access can vary significantly between urban and rural areas, with rural areas often having less access to healthcare services and facilities. So, health insurance coverage is another important factor, with countries that have higher coverage rates generally having better healthcare access. While some countries in Southeast Asia have made progress in improving healthcare access, there is still a lot of work to be done to ensure that all the people in the region have access to essential healthcare services. So, in conclusion, Um, healthcare access still remains a significant challenge in Southeast Asia, with wide disparities in healthcare infrastructure and resources between countries and even within the countries themselves. Financial barriers, lack of healthcare facilities, and limited access to prevention measures for infectious diseases continue to limit the ability of many people in the region to receive adequate healthcare. So addressing these challenges is going to require, again, a multifaceted approach that involves increased investment in healthcare infrastructure and resources, improved access to healthcare services, and expanded efforts to prevent and treat infectious diseases. And it's going to require a lot of political commitment, both national and on regional levels, as well as partnerships with international organizations and even private sectors to ensure sustainability and equitable healthcare access for all. Um, Overall, ensuring access to quality healthcare is really critical to improving the health and well-being of the people in Southeast Asia, and achieving universal healthcare coverage should remain a top priority for policymakers in the region. By working together and investing the necessary resources, I believe we can overcome the challenges and build a healthier future for all. And I do just want to end by saying thank you for listening to this presentation on healthcare access in Southeast Asia. Thank you.